Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome back. This is Dr. Jacobs. In this video, I'm gonna go over 7 surprising causes and risk factors for occipital neuralgia pain. It's very important to understand those causes and factors that could lead to occipital neuralgia pain, because those are part of getting to the root cause of the problem and treat it effectively. So the first cause and risk factors is irritation of or injury of the nerves. As you see here, the occipital nerve is actually a combination of 3 nerves, that C1, C2, C3, that is coming out from the base of your skull here and distributing to the head and the back of your neck area. So that distribution, if you have any compression, any irritation in this area, could cause the sharp shooting pain that goes up on one side, and sometimes patient could have the occipital neuralgia in both sides and going up all the way to your eyes. And that irritation or injury is actually something could compress on it from poor posture, poor body mechanic, and that's actually the second cause of occipital neuralgia pain. So as you see in this image, this is a very good image. So if you have a good posture, your head in neutral position as the first guy here, your head weighs 10 to 12 pounds. When you start to bend your head forward, watching TV or reading or using your phone, the more you're going to bend forward, the heavy your head will be, and that could cause a strain on this area that could cause fibrotic tissue and fascial restrictions and inflammation that cause compression on the occipital nerve. And as you see, the more you bend forward, the heavier your head will be, the more strain gonna happen here and more irritation to the nerve that could cause compression on the occipital nerve and cause those symptoms. So it's very important to know poor posture, poor body mechanic has tremendous effect on the occipital neuralgia. So the third cause is whiplash or injury from strain or sprain, which is very obvious if you have a motor vehicle accident, you hit your head, or you had a sports injury that could actually hit this area that's straining the muscle and cause occipital neuralgia pain. Also, a fourth reason or cause is compression of the C2 to C3 nerve ending, and that could happen from degeneration in the area or any other trauma that compressing on the nerve on that spot. So the fifth cause is herniated disc. So herniated disc, it could happen from poor posture for a long time, or genetic, or prolonged sitting or accidents. I'm just gonna show it to you here in the lumbar spine, but the same thing happened here, but I don't have the disc coming out. So your disc should be nice and smooth like this. So you see it's nice and smooth and even. When you have herniated disc, that red spot in here, it's sticking out. When that happens, it compresses on the nerve. So in the top here, if you have herniating disc, that could compress on the occipital nerve in this area, that could cause sharp shooting pain. It's common to have herniated disc as a result of poor posture, poor body mechanics. The sixth cause for occipital neuralgia pain is degeneration in the joint, in the vertebra itself. So instead of your joint nice and smooth, the vertebrae, you have osteoarthritis, which is actually degeneration in the joint, and you have unevenness, fibrotic tissue in the joint that could compress on pushing on the occipital nerve. This last reason could cause from patient that is experiencing or having disease like gout, diabetic, or infection that cause extreme or severe inflammation in the occipital nerve, that compressing on the nerve and cause those symptoms. I will leave a link below this video for the 3 most powerful, effective treatment to get to the root cause of occipital neuralgia pain and experience pain relief. Feel free to check that video underneath this description. And if you have any question or comment, leave it in the comment section and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.